Mm-hmm. Okay, I think we're live. Hello, everyone. Hello, everyone, and welcome. Okay, thank you so much for joining us today. My name is Vea, and I'll be your host for today's live webinar. I'm one of the first person you will talk to when you're inquiring with us. The topic for today is understanding ALS or MND. Whether you're living with ALS or MND, supporting a loved one, or simply looking to learn more, we're glad that you're here. Today is a good opportunity for everyone to understand about it and to hear expert insights from Dr. Nasir. So, before we begin, I'd like to introduce our speaker. Dr. Nasir is our Global Medical Director. He has an extensive experience treating patients with spinal cord injuries and neurodegenerative conditions, including ALS or MND. He'll be sharing his expertise and answering throughout the questions throughout the sessions today. With that, let's get started. Dr. Nasir, thank you for being us with today. To begin with, could you briefly explain what is ALS or MND?
Thank you, Vea, for hosting me today, and thank you, everyone, for joining. Um, ALS, or amyotrophic lateral sclerosis, um, is part of a bigger group of medical conditions called motor neuron diseases. So, any um, medical condition, any neurological condition involving motor neurons, either upper motor neurons or lower motor neurons, is called a neuron disease. ALS is a classical form of a motor neuron disease. Sometimes it's interchangeably being called motor neuron disease because it's a very, very classical form. It's also, unfortunately, the most aggressive adult onset motor neuron disease, which involves both upper and lower motor neurons. Um, and it's We do not know exactly what is the cause of the disease, but most of the scientific community, they believe it's predominantly a
Mm.
genetic medical condition. In 10% of the patients, we know exactly which gene is affected. Um,
Mm-hmm.
but in 90% of the patients, we are not sure. But again, most of the doctors and scientists, they believe it's probably a genetic medical condition where
Mm-hmm.
individuals with certain genetic makeup, when they are exposed to certain lifestyle or certain environmental factors, it triggers um, neuroinflammation, neurotoxicity in the brain and in the spinal cord, which causes the death and loss of motor neuron diseases.
Mm-hmm. For patients with this condition, what happens in the body when someone develops ALS or MND, doctor?
Yeah, so there are two types of ALS. There's two subtypes. One is called a motor onset ALS, which primarily affects, at least in the initial stage, it affects the upper body limbs or lower limbs. Um, and at a later stage, it develops into a more progressive disease where it starts to affect speech and swallowing functions and respiratory function. The other one, which is a more aggressive form, is called bulbar onset because it starts to affect, initially, it starts with speech and swallowing functions, then it moves to respiratory function, but also ultimately it also moves to upper limb and lower limb motor function. Um, so, depending upon uh, which specific subtype someone is diagnosed with and at which stage of the disease we are at. The Mostly the symptoms include motor weakness because primarily it's of course is a motor neuron disease. Um, Speech and swallowing function, fine loss of fine and gross motor skills, and at moderate to advanced stage, patients also start to lose respiratory function. So it's quite aggressive, of course, disease with typical prognosis after diagnosis is between 2 to 5 years.
Mm-hmm. And earlier, you briefly mentioned that ALS and MND in different countries it could be, interchangeable, or I'm not sure, or maybe it's a different diagnosis, or they, well, patient hear different names. So why do some in some places they call it ALS, and some they call it MND? Maybe we can deep dive into it. Mm-hmm.
Yeah, so especially in Europe. So in USA, most of the doctors, they are able to label or specify the type of, once someone is diagnosed, they are able to specify which specific type of motor neuron disease. For example, it's by the ALS or PLS, which is primary lateral sclerosis, which primarily affects upper motor neurons, or it could be SBMA, or it could be a progressive bulbar palsy. It could be spastic paraplegia. So in especially in USA, they are able to diagnose the condition
Mm-hmm.
very specifically. But mostly in European countries, they do not specify the specific type of the motor neuron disease. So they generally label it as MND,
Mm.
in which is in most of the cases is actually ALS, to be very specific.
Mm. Okay. You briefly mentioned as well earlier that it can be inherited. Um, are there any other possible causes of ALS or MND, or is it always the case that it's genetics or inherited?
So in about 10% of the patients is genetic or familial ALS, and
Mm-hmm.
in most of the patients, so in about 90% of the patients with familial ALS, there is a gene which is called SOD1 gene. So it's a specific gene which is affected. So in 90% of the patients, it's called sporadic because they do not have a strong family history, or they are, they do not have this specific genetic mutation in SOD1 gene. So it's called sporadic because it has very sporadic random onset.
Mm-hmm.
Um, and um, so the but but we still think it's probably strongly genetic. So it's uh, and in terms of the triggers, I have seen some patients. So in most of the patients, they do not have a specific exposure to like toxins or specific um, occupational exposure. But in some patients, I have seen um, uh, where they do have some history of occupational exposure, because some patients who work in landmines, for example, sorry, mines,
Mm-hmm.
or they do have certain level of, they work in certain level of like chemical industries, they do have I think slightly increased risk of diagnosis with ALS. But there is no strong link between occupational exposure and
Mm.
the diagnosis of ALS. So I think, just to conclude, in about 90% of the patients, we do not know exactly what is
Mm.
causing the disease. We only know the pathophysiology of the disease. Of course, we know what are the factors, what kind of toxins are there, what kind of, for example, glutamate toxicity, neurotoxins are there, which are causing the destruction of motor neuron. But we do not know exactly what was the specific cause of the disease.
Mm-mm. Oh, okay. Because sometimes it seems like with diseases or conditions, patient would like to understand what causes it, but we can move forward to the symptoms and progression, basically, to identify, to help them see possible symptoms. So one of the first question is, what are the early symptoms that patients and families may first notice, to especially if they have his family history with these diseases?
Yeah. So the early symptoms could be, in motor onset disease, could be loss of or muscle weakness, hypo myotrophy, loss of fine and gross motor skills, loss of balance and coordination, but they also have muscle fasciculations. And in patients with bulbar onset, usually the first
Mm-hmm.
symptoms are a loss of speech and swallowing functions. They
Mm.
they have somewhat normal or near normal fine and gross motor skills near normal ability to control their upper limb and lower limb muscle function, but they do have weakness in their speech and swallowing muscles. Um, and then it progresses there. It starts to involve, of course, other affected areas, and ultimately, in late stage or moderate stage disease, patients start to have weakness in their respiratory muscls. Once someone starts to have weakness in their respiratory muscles, normally initially they need non-invasive mechanical ventilator, for example, a
Mm-hmm.
BiPAP. But ultimately, they may require tracheostomy and they may require invasive ventilation at a late stage disease. Many patients, they also completely lose their ability to speak and swallow, so they are also on like a feeding tube, for example, a PAC tube at a late stage of the disease.
Mm-hmm. Okay. Um, for some patient, they may see the symptoms, and it seems like it's quite difficult to diagnose this disease. Why do you think ALS and or MND sometimes takes time to actually diagnose?
Yeah, so in many patients, there is a straightforward diagnosis.
Mm-hmm.
Usually, the neurophysiological studies, for example, electromyography, EMG, is conclusive. It shows certain findings, and once we combine those findings with medical history and clinical findings, it's a straightforward diagnosis that uh, someone is diagnosed with at least motor neuron disease. Many times we are able to again label a specific type of motor neuron disease, for example ALS, looking at the pattern of the disease, the clinical findings. But at least in many patients, even if we are not able to label specifically whether someone is suffering from ALS or maybe some other form of motor neuron disease, at least we can confirm that they're suffering from motor neuron disease. But I agree, in some patients it could be very confusing.
Mm-hmm.
So for some patients, there is um, uh, there are some symptoms which overlap. For example, sometimes with Lyme disease, sometimes with other inflammatory conditions, sometimes with paraneoplastic syndrome. So it could be a challenging diagnosis in certain individuals, but in my experience, in uh, majority of the patients, it's uh, it's possible to diagnose ALS, or at least diagnose someone with a wider motor neuron disease.
Mm-hmm. Okay. For moving forward with the symptoms and progression, does ALS or MND progress in the same way for each person or for every person? Mm-hmm.
The short answer is no. It can be, extremely unpredictable. So some patients, they have a very rapid onset of symptoms, but then the disease becomes stabilized for certain period of time. Sometimes for as long as many years, actually, where it does not progress anymore, and then something happens, and then they start to progress again very rapidly. Uh, but on the other side, some patients, they have slow but on steady progressive disease. Yeah.
Mm-hmm. Yes, and I remember you mentioned that the progress may be different as well depending on which areas are affected. So yes, the the progress is not going to be the same as every person. Um, what changes should patients and caregivers report to the medical team as soon as possible? Mm-hmm. Hello, doctor.
I'm sorry. Any kind of muscle weakness, any kind of fasciculations, any kind of uh, loss of speech or swallowing functions, I would say, um, specifically some patients, when they have loss of grip, they have loss of fine motor skills, they tend to lose their balance and coordination. Many patients, they have history of falls, Mhm. So
Mm.
any kind of change, any kind of symptom, of course, this kind of symptoms should be taken very seriously.
Mm-hmm. Okay, thank you, doctor. Once someone receives a diagnosis, the next question is normally, what can I do now? So we can move forward to the possible treatment options, um, or the possible treatment, or the topic of treatment itself. Doctor, do you think any current treatment can stop or reverse ALS or MND?
Yeah. So the treatment could could be divided into two groups.
Mm.
The first group is actually FDA approved uh, drugs. So there are currently two FDA approved drugs, Riluzole and Edoravon. So these are two um, uh, FDA approved treatments available for ALS. Both of them are antioxidant in nature because um, ALS involves strong oxidative stress. It's important part of uh, disease pathology where and oxidative stress causes
Mm-hmm.
the destruction of motor neurons in the brain and in the spinal cord. So both drugs are antioxidant in nature, where they reduce the oxidative stress, so they are able to have a little bit of neuroprotection. They are able to protect the motor neurons against oxidative stress, so they can increase the lifespan of the motor neurons. So basically, those both drugs are prescribed to ALS patients. Um, Riluzole is the most commonly prescribed drug, and
Mm.
but the efficacy is very very limited. Unfortunately, on average,
Mm-hmm.
Riluzole, if even if taken during very early stage of the disease, it adds between 2 to 6 months of life um, life expectancy in each patient. Um, and But nonetheless, most of the patients, they are on Riluzole. Then the second group of medical treatment could be considered alternative treatments. So stem cell
Mm-hmm.
treatment is one of the treatments which we are specialized in also. So stem cell treatment also, it does have antioxidant, anti-inflammatory, neurotoxicity properties, but they also have regenerative properties where they're able to basically promote a little bit of regeneration of motor neurons. So they not only slow down the disease progression, but they can also reverse the symptoms to a certain extent.
Mm-hmm. Okay, and we spoke about the treatment, right? One question: what are the main goals of treatment when ALS or MND currently has no cure?
Yeah, so the treatments are again, the the first line of treatments are FDA approved drugs, and the second line of treatment, which are also called alternative or exploratory treatments, is the stem cell treatment. Yeah, so these are two group of medical treatments available to the patients.
Mm-hmm. Okay, sure. So since we're talking about Verita Neuro and stem cell treatment, uh, s- so Verita Neuro has treated many people living with ALS, MND using uh, stem cell treatment, and some of them maybe receive the other treatments as well. And the question is, could you explain how this treatment fits into the wider care of plan? Should, for example, if they're doing this other treatment, should they stop and do the other, or how can it be? Um, Maybe we can do the treatment for the maximum result.
Yes, so normally most of the patients are on Riluzole since the day of diagnosis, um, and uh, um, they should continue on Riluzole as a primary treatment option. The stem cell treatment can be taken up at the same time because, based on our experience, our understanding how the Riluzole works, how stem cell treatment works, there are no adverse interactions because riluzole is primarily antioxidant, so
Mm-hmm.
it doesn't interfere with the stem cell treatment in any negative way. So those two treatments can go on um, at the same time. Mhm.
Mm-hmm. Okay. You briefly mentioned about the stem cell treatment. Um, would you like to deep dive a little bit more on how the stem cell can work to help with ALS or MND?
Yes, so primarily stem cell treatment has three main mechanisms through which it acts positively on the motor neurons. Um, the first one is um, their antioxidant, anti-inflammatory, anti-neurotoxicity properties. So they are able to reduce the inflammation, reduce the oxidative stress, and able to reduce the neurotoxicity, which has some positive impact on the survival of the motor neurons. Then the second one is stem cell treatment. It basically enhances the certain growth factors, for example, nerve growth factor, BDNF, um, and certain anti-inflammatory cytokines in the brain and in the spinal cord. So those cytokines, they have neuroprotective effects. They basically increase the survival of motor neurons. They reduce the oxidative stress against the motor neurons. The third one is their ability to basically um, stimulate our body's own stem cells. So we do have a certain level of neural stem cells in our brain and in the spinal cord. So stem cell treatment also um, increases or at least stimulates the release of the resident neural stem cells. Many patients, they are sometimes they're under the impression that stem cells, they become into functional neurons. They directly regenerate into motor neurons. Well, this is true, but this only happens under laboratory conditions, because if you put stem cells under strict laboratory conditions, you give them right amount, right type of proteins, they do differentiate into motor neurons actually. However, we believe in our body, the circumstances are very different as compared to lab controlled environment. We do not think stem cells in the body directly stimulate, directly uh, uh, translates to functional motor neurons. They do promote the regeneration of motor neurons. They do increase. They do increase the survival of motor neurons. They protect the motor neurons. So we can call them, they do have regenerative properties, but they do not directly uh, regenerate into functional motor neurons. Unfortunately, it's not that simple.
Mm-hmm. Right. Thank you for the explanation. Um, since we spoke about the stem cell treatment, I while stem cell treatment is available for patients such with this condition, I believe that it may not be, for everybody. It may be because of uh, what type they have or which stage they are in the disease, right? So, with regards to eligibility, how do we decide? How do you decide, doctor, whether an ALS patient or if the patient is suitable for the treatment?
Yes, so there are a few factors we can use to determine if someone is more likely to respond to the stem cell treatment. So first of all, in my experience, the early onset ALS is more progressive. If someone is diagnosed at during their like late 20s, early 30s, um, they usually exhibit a more progressive disease. Um, Also, patients with familial ALS, especially if they have a strong family history, also they have confirmed genetic mutation, they also show progressive disease. Then the patients with bulbar onset, they also are more progressive as compared to motor onset. So there are
Mm.
a few factors we can use: the specific the specific symptom, the onset, the age at which the disease starts. We can use those factors to really get an idea if someone is more or less likely to respond to the treatment. Uh, and but most of the patients, they do qualify for stem cell treatment. um,
Mm-hmm.
they may have different response again, but at
Uh,
least they do have certain level of probability of recovering from the disease after stem cell treatment. Only a group of patients where they have late onset disease, where they already have, let's say, they completely lose their ability to speak and swallow, they are on feeding tube,
mm,
they are on mechanical ventilator. uh, Unfortunately, those patients may not be qualified for the stem cell treatment. It may be too late for them to recover
mm,
from.
mm-hmm. Okay, since you mentioned about for some patients who are kind of like in advanced stage, they may not qualify. Is there actually a better stage of the disease to explore this treatment?
Well, sooner the better. There is really uh, uh, no specific time period. Uh, Generally speaking, as soon as they're diagnosed with the motor neuron disease, I think they should take it very seriously, because, of course, time is very important. Uh, from from available treatment point of view, either it's conventional treatment or stem cell treatment. Time is very important because every day or every week, certain populations of motor neurons are being lost, and like I explained, it's almost impossible to replace those lost populations. Our best chance is really to protect whatever is spared, protect the motor neurons as much as possible to slow down the disease and increase the life expectancy in those patients. So time is very, 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 very
Important.
important in this sense. Yes.
Mm-hmm.
So sooner the better. Whenever they are ready for the treatment, they should consider the treatment. Um,
Mm-hmm.
so from in our experience, most of not most, but many patients, they come at a very early stage as soon as they're diagnosed with like very minor symptoms. Sometimes patients, they do actually have, because they sometimes they have a family history, so they are diagnosed proactively. They don't even have any symptoms. They are diagnosed based on the genetic test. So they do actually come even before the onset of the symptoms also.
Mm. Okay, so to answer that, I agree, doctor. Early detection. It is best to act on it right away. Um, so at Verita Neuro, we do this stem cell treatment. I It's not just the injection that we include in the protocol. We do have some rehabilitation as well, in the 1 week treatment. What does rehabilitation play in helping someone live with ALS or MND?
Yeah. So rehab is also an important part of the treatment. Uh, uh, so the rehab is basically used to kind of guide the stem cells. Stem cells, once injected in the body, they need some kind of signals, as to what should they do in the body. um, so for patients who do physical therapy rehabilitation, it kind of forces the stem cells to translate into, um, go to specific areas. So rehab plays an important part in what is called homing mechanism. Homing is when stem cells migrate in the body during
Mm-hmm.
first 4 to 6 months after the injections. And so rehab is an important part. So we do offer rehab. We do perform rehab during the treatment, but we also recommend patients to continue rehab for 4 to 6 months. um,
Mm-hmm.
it's important to understand, unlike some other medical condition, for example, stroke or spinal cord injury, in
Mm-hmm.
ALS patients, we do not recommend a very, very aggressive rehab, because aggressive
Mm-hmm.
rehab causes muscle fiber, loss of muscle fibers. In other individuals, of course, it's easier to recover. But in ALS patients, since they have underlying motor neuron disease, it's extremely
Mm-hmm.
difficult or impossible to recover any loss muscle
Mm-hmm.
tissue. So we focus on um, quality of the rehab rather than the quantity of the rehab. So but still, it's an important part of the recovery. One of
Right.
the treatments we offer is called electromagnetic stimulation. We use
Mm-hmm.
transcranial magnetic stimulation to stimulate motor cortex, but we also use uh, the peripheral electrical stimulation to stimulate the muscles. Sometimes we call it paired associative stimulation. So we combine electromagnetic stimulation of the central nervous system and peripheral electrical stimulation of the peripheral muscles to stimulate basically both the central and the peripheral nervous system together. But yes, it's an important
Mm-hmm.
part of the treatment.
Mm-hmm. Right. It is good. It is very good information, doctor, that you mentioned to, kind of like be careful or do not create too much fatigue if patient has this kind of disease, because sometimes patient they think they have weakness, so they need to work it out a lot of times. So it is good that you mentioned, doctor, that it's about the quality, not the quantity of the
Yeah,
rehabilitation they're going to do if they have ALS or MND.
yeah, this
Thank
is
you for
true.
that, doctor. Okay. You briefly mentioned about the external stimulation, doctor. Are there any other equipment or home changes that can help someone, to have the recovery and be more independent in the long run?
There are a group of supplements. So many patients, they actually, even before they come for the treatment, they already, when they go to their primary care physician or their neurologist, usually they are recommended with certain combination of supplements. Those supplements are mostly anti-inflammatory, antioxidant. Yeah, so I think this is something every patient who is diagnosed with motor neuron disease, they should explore. Again, it's not a good idea to overwhelm the body. I have seen some patients who had been on um, significantly higher dosages of supplements,
Mm-hmm.
sometimes because uh, because sometimes the immune system can be overwhelmed, and instead of being anti-inflammatory, it becomes pro-inflammatory. I think the quantity of any supplements or any products they are taking is also important. Um, so this is what they do many times. So this is an important, I think, a tool to cope with the disease to some extent. Physical and occupational therapy, speech therapy, respiratory, chest physiotherapy is also
Mm-hmm.
important in those patients. And if possible, they can also explore the possibility of electromagnetic stimulation
Mm-hmm.
to stimulate the motor neurons in the brain and in the spinal cord.
Mm-hmm. Right. So say, doctor, the a patient qualified to do the stem cell treatments, and in addition to the rehabilitation, what should patient realistically expect from the treatment, or from the protocol that we offer at Verita Neuro?
Yes. So the motor neuron disease in general, they are aggressive forms of neurological conditions.
Mm-hmm.
In most of the patients, we do not even know um, what causes the disease, let alone uh, our ability, to cure the disease. Of course. So I think this is important point to remember, that any kind of treatment is not focused on curing the disease or correcting the underlying cause. So the stem cell treatment is a tool to cope with the disease, where it slows down the disease progression. So in terms of the realistic expectations, I think it's realistic to expect a significantly slower disease after the treatment. Sometimes the disease could be stopped for many months, sometimes for many years.
Mm-hmm.
I think so. So this is one part of expectations. In terms of the reversal, we have seen in many patients we see some reversal where they actually have better functions, but this is this does not happen in every case we treated. So realistically speaking, I think a slower or um, um, halted disease progression is a more realistic treatment outcome.
Mm-hmm. Right. So we move forward, doctor, to the medical evaluation process. Um, what kind of reports or information should patient prepare before having the consultation with you?
Yeah, usually neurophysiological studies, specifically speaking, EMG,
Mm-hmm.
electromyography, is the most important tool really to get some idea about the disease. It can give useful information. It can help um, us to diagnose. So I would say EMG is a primary investigation we use to confirm the diagnosis. So they should prepare EMG nerve conduction study. And if of course if there is a strong family history, many patients they also
Mm.
go through a genetic test. So if if this is applicable also, but I would say in most of the patients, electromyography is the most important tool to
Mm-hmm.
diagnose ALS or
All
motor
right.
neuron disease in general. Yes.
So it's basically doctor an EMG medical report, one pager, correct?
Correct.
Mm.
It could be quite comprehensive. It could be,
Ah,
like sometime up to like 10 pages. But yes, that's the most important report we
okay.
can use to diagnose ALS, or get an idea that this is a motor neuron disease. Because
Mm-hmm.
EMG can also give us useful information to it can distinguish whether it's the peripheral. It can rule out many other conditions. It makes it easier to narrow down the uh, the diagnostic criteria and get closer to the final diagnosis.
Mm-mm. All right. Yes. So for the viewers who would like to know their eligibility or the suitability for the treatment, yes, we can do the consultation, definitely. Just like what the doctor has mentioned, we would need the EMG, and in addition to that, we will basically, um, once you reach out to us, we'll be connecting with you, and we'll be sharing you a bit more about the possible treatment and what are the requirements. In addition to the reports, we would also need what we call online medical form. It's basically um, a form where we ask a little bit more questions about the current condition or some more information that will be necessary or very important because we need to carefully evaluate the case. All right. So once the information is ready, the patient representative will prepare your case folder and will let the medical team review the case for you. All right. And then if we think that patient qualify for the procedure, then we'll contact you back to arrange the consultation. So it's actually quite simple. It may take just a few days for the medical evaluation, and hopefully in a week we can do the consultation. All right. So feel free to reach out to us should you wish to do that, and let's see how we can best help you at this stage. All right. There are actually some few frequently asked questions, doctor. Does muscle weakness or twitching always mean someone has ALS or MND?
Uh, it's not the absolute um, diagnostic criteria, but uh, it's quite common
Mm-hmm.
as an initial symptom. So it's an important symptom actually, muscle twitching of fasciculations. It shows it indicates the deteriorated health of motor neurons. Yes, so I would say it's not itself is diagnostic, but it's a very important feature actually. Yes.
Mm-hmm. And another thing came up is, can it be cured or completely reversed? We have mentioned, we do not promise any cure, all right? So just like what the doctor has mentioned, one of our aim is to hopefully slow down disease progression and improve the quality of life. And we also do not promise complete reversal of the disease. Okay, so I think it's very important for everybody to know. Now we would love to open for session for question and answer. If there are any, please send them in the comment sections, and we'll answer as many as we can. Are there any questions? Anything else? I see there are some questions about spinal cord injury. However, our focus for today is more about ALS or MND. So if it's for spinal cord injury, feel free to reach out in our inbox. We'd be very happy to help you. And I see Igor is also watching us. Hello, Igor. Okay, I think there's no more questions. Doctor, before we close, Doctor, do you have a final message to leave for patients or any caregivers watching today?
Yeah, so like uh, sometimes the diagnosis of cancer, the diagnosis of ALS could also be very, very devastating. Many patients, they don't even, they never actually heard about this name before. So when they're diagnosed for the first time, they ask the, of course, right questions about prognosis, life expectancy. So it could be quite devastating news
Mm.
for someone being diagnosed with motor neuron disease, um, which is true. It's indeed a very, very devastating medical condition with very poor prognosis, very limited life expectancy. However, there are options, which, for example, stem cell treatment, which can be used to tackle the disease to some extent, improve the quality of life, reverse the condition to some extent, and also increase the overall life expectancy. So anyone diagnosed with motor neuron disease, I think they can definitely look into stem cell treatment as a possible option.
Mm-hmm. Okay, thank you, Doctor, for your message. I see there are some questions. Wait a moment, Doctor. There is one question. Sorry, Doctor, to add before we end. What is the most progression your patient got or ever get?
Some patients, they are, so some patients, they do recover a significant amount of muscle mass, which is actually very rare. But there are patients in the past we treated where they actually had lost a lot of muscle mass, but after the treatment they actually regained the muscle, which is again is remarkable, is like a miracle. And also, the disease progression had been stopped sometimes for many years, for up to like 3 4 4 years after the treatment.
Mm-hmm.
Again, this does not happen in every case, so of course we, anyone listening should not take it for granted. It's also possible that there may not be, unfortunately, any response at all, although this is rare, but it's possible. But yes, there had been patients in the past we treated with stem cell treatment where the disease was completely stopped for many years, but also they got some reversal in their physical condition.
Mm. Doctor, there is a last question, Doctor. What is the possibility that my children, what are the possibilities that my children will have ALS if I have, if that was.
So yeah, so uh, it's rare because um, so in patients who are diagnosed with the, like, who are diagnosed with familial onset, for example, SOD1 gene mutation, there is significant possibility that the disease can be passed on to the children. But patients with sporadic onset is very rare, but there is still possibility, again, depending upon, there may be a specific gene, which could be a dominant gene, and it
Mm-hmm.
can, so there is 50% chance that the disease maybe can be passed on to, um,
Mm.
onto, yeah.
Tertiary. Okay, sure. Thank you, Dr. Nasir, for answering those questions. Um,
Okay.
yeah, okay, doctor. For those, I would just like to inform everybody for if you are watching, if you're a patient or you're watching for your loved ones, you can make an inquiry through us, and our patient rep will be contacting you to answer any of your questions and help facilitate the medical evaluation for you. Okay, you can send us private message, and maybe we will also include in the comment section our inquiry form, so we can get back to you as soon as possible. All right. Thank you, Dr. Nasir, and everyone for joining us today. We hope you found this session very informative and helpful.
Yeah.
And we hope to see everybody again in the next live session. Thank you,
Thank you.
everyone.
Yeah. Thank you, everyone. Bye.